This program is a paid commercial announcement and in no way represents the views of WPH.D or its management.
Talk Radio 1210 WPH.D, WPH.D, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch, and your host, John Damazzi.
Seems like we've said this quite often this winter. We're going to do our best to keep you warm today. I mean, geez.
They say it's warming up, John. I don't know.
Okay. Well, yeah, they're saying this week. But today, It's freezing cold. Good to have you with us as always. Health Watch, Sundays, 8 till 9. That's the time, and this is the place. Talk Radio 1210 WPHT. On this particular program, yes, we talk about health, specifically how Dr. Molly Fantasia and her staff at Innovative Medical Associates can help you as far as your overall health condition is concerned. We talk about the who, what, when, where, why, and how of Innovative Medical Associates, what it's all about, how it can potentially help you. And, of course, we welcome your participation at 855-839-1210, 855-839-1210. That's the number. At any time during the course of the show, if you have a question or a thought for Dr. Molly or a medical challenge you want to run by her, feel free to call in, 855-839-1210. As always, Dr. Molly, a good day to get healthy. And good day to keep warm and get healthy.
Hey, John, I'm glad we didn't have to fight the snow today.
That's right. Yeah, well, we did that last week, right?
That's right.
That's enough.
Right. Yeah. Amen. Amen. Yeah, John, it certainly, we certainly can do the overview, as you like to start with. And Integrative Medical Associates is a collaborative. We work out of my facility in Marlton, New Jersey, and it is a primary care facility. So, that being said, we can do anything anybody else does within a certain parameters for primary care. So if you come in and my docs say, oh, well, this patient might need a hypertensive medication, we can give it to them. We certainly can write the prescription. If you need a shot, an antibiotic, we can do that. But our philosophy is what's different. We'd like to use the least amount of pharmaceutical to effectuate the change, maintain a minimum amount of side effects, and move a patient through their medical continuum.
Interesting that later on in the show, I know you wanted to talk about this, and we're going to delve into it, the word subclinical. Oh, yeah. And that's important in your facility because when your docs prescribe, it's in general a subclinical dose. Something in
terms of the hydration therapies, yes, but not in terms. If you need a Z-Pack, you're going to take the Z-Pack must be taken in its entirety. Lots of people take the first 2 doses. They feel better. Oh, well, I don't need the other 4. Right. Well, that's not correct. In other words, you need to use the prescription medications in terms of traditional treatment, just the way the physician or the healthcare provider absolutely writes for it. That's important. But if we can minimize how many of these things you need by augmenting with the natural substances, getting you through a situation quicker, guess what? That's when this is very important.
And that's really your philosophy, your overall philosophy.
Absolutely. And where do you get these natural substances? Well, you can go to the health food store, but you got to know the brands you're getting, and you got to make sure that what you get doesn't interfere with your other medications and that kind of situation.
The whole process is delivered via hydration.
In our facility as much as we can, yes.
Why is that?
Because it's a more effective way, a quicker way to get the actual outcome that we're looking for and the improvement in your quality of life in particular. However, that's, if you need a medication, let's say you have a chronic condition, you need a medication for hypertensiveness or high blood pressure or extremely high lipids, we will put you on that. We're going to try to use the lowest dose, the lowest available dose, but we can do that and then augment with the hydration.
And speaking of hydration, you've often talked here on the show about a variety of conditions and medical challenges that you've helped patients with.
Oh, yeah.
But in terms of hydration, what are the expectations for people? Do they come in once a week, twice a week, three times a week?
It depends. It depends on the severity of the condition. Is it a chronic condition where we're looking, all of these conditions with, let's say, autoimmune in terms of the rheumatoid conditions? That's a good one because, many of these patients are on these terrible drugs for this type of condition, injectables, etc. Our objective is to try to minimize that because of the side effects. So they may come in once a week for quite a while. But then we have a finite set of hydration therapeutics where we say, okay, you have this particular problem and it's an acute problem. We can handle it in such a way that you don't need to come in for the rest of your life, or certainly for a period of 10 months or something. But what's interesting? Most of my patients who go through a traditional type of hydration therapy treatment protocol tend to want to come in on an ongoing basis.
And that's what you like to call maintenance.
Correct.
Right? And
right.
It's just so you maintain
the
level you have before.
Right, exactly. The idea is we don't want people to have regress. And if they regress, it tends to not only be a regression of the disease process or whatever it is, it actually tends to be more harmful to the patient in terms of their quality of life.
We're going to talk later on in the show about your cancer support and other types of situations. But in general, you usually get two questions in the consultation, your initial consultation. One, does it work? And two, what cases is it most likely to be most effective?
Well, I can tell you that it is very effective in autoimmune diseases. It's very effective as a supportive therapy for cancer patients. It's very effective in tuning people up in terms of cardiovascular diseases and maintaining their lipid profiles. It's very effective in maintaining a certain amount of men's health. It's very effective. So, again, it's an individualized therapy. In our clinic, nothing is one size fits all. And that includes the length of time you're in the chair. It includes how many treatments a week or how many treatments a month or every quarter you need. So everything is individualized, including what's in the bag. And yes, okay, the bags all looked yellow. That's because there are forms of B vitamins that tend to be yellow. And many times that's in everybody's bag, but it's not the only thing that's yellow. There are amino acids that can become yellow too.
Right.
But it's an amazing thing. I just had a patient this weekend call me and said, well, my bag wasn't that yellow this week. Well, it's because I changed up the recipe this week based on what was going on for you. Oh, that made sense. I felt good, but I thought it was a little weird. Okay, I can live with that.
Mine was orange, by the way.
Yes, I know. So, I mean, that's the case. And then I had one other patient call me and say, oh, my goodness, my urine is dark yellow. I said, was it clear, dark yellow, clear? Well, no, it was dark yellow. Well, was it clear? Could you see through the yellow? Oh, yeah. Then it's okay. Why are you, I said, why are you putting your urine in a cup if we're not asking for it? Oh, I don't know. I just felt like it. Okay. I'm open for that.
Talk about, for a moment, how effective vitamin C is.
Oh, my goodness. Vitamin C, the big daddy of it all. Yes, vitamin C is very effective, both as an antioxidant and a pro-oxidant, which means it can go in and actually go after free radicals, or it can go in and help some free radicals, particularly for the cancer patients. Synergy with vitamin C, other nutrients that we use, particular things, natural products that we use with vitamin C, make all the difference of how vitamin C is utilized in the body. But across the board, vitamin C, Linus Pauling did us a wonderful, wonderful gift by letting us know the many uses of vitamin C therapy.
Talking to one of your patients the other day in your clinic, and he said, yeah, I hear you talking on the radio all the time about vitamin C and how you take it.
Yeah.
And I do. And guess what? For me, it's very effective.
And I will tell you something else. Everybody comes up, well, my doctor said you just pee it out. Okay, you do. All right. But if you have enough of it, some of it is sticking, right?
And that's the reserve you
That's
talked
the
about.
reserve
Right.
I'm talking about. And let me tell you, the forms of vitamin C. Vitamin C is vitamin C is vitamin C. But extracts of vitamin C have many uses, John. And I'm a believer in the good Lord, and I know He's put this on earth in fruits and vegetables for a reason.
All right, we're coming up on our first break of the morning. The program is called Health Watch. You'll find us here every Sunday, 8 until 9, here on Talk Radio 1210 WPHT. I'm your host, John DeMasi, with the one and only Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. We're talking about the who, what, when, where, why of Innovative Medical, and we're going to talk about some specific situations after the break. But if you have a specific situation that you want to run by Dr. Molly, this is a good time to call in. 855-839-1210 is the number, 855-839-1210. We're coming back with more Health Watch with Dr. Molly Fantasia after these words. Back here on Health Watch, and as always, operators standing by at Innovative Medical Associates. You can call them directly if you're a little bashful, you don't want to come on the radio, you want to get more information. They'll be happy to do that for you. 856-489-0505. 856-489-0505. That's the number for Innovative Medical Associates, Marlton, New Jersey. You can call right now. You can call after 9 o'clock. You can call tomorrow, whenever. 856-489-0505. And the website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. Before we get to back to the show and to our caller, we do want to mention that Dr. Molly wants to make this Valentine's Day very special for both of you. She has a line of skincare products that is a perfect Valentine gift. And really, Dr. Molly, men or women can use this, right?
Oh, absolutely.
So it's...
I have a gentleman right now. He calls for the stem cells. He said it's really helped his under eye bags. I said, great.
Okay. So all you do is go to the website, innovativemedicalassociates.com. You'll see the information. You can actually order it online. So listen, you do it now, and it'll get shipped to you, and you have your one of your Valentine presents.
Amen.
All right.
All right. That's good.
Innovativemedicalassociates.com is the website. Our show is Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. Let's go to the phones. Christine is in Ballackinwood. Christine, good
Hi,
morning.
Christine. How
You're
are
on with
you?
Dr. Molly.
How are you, Christine?
Good morning.
Good morning.
I have two questions.
Yes, ma'am.
One, my urine turned orange in the last couple of days. I had a terrible pain under my right rib that I massaged away. So I'm wondering if there's a big problem.
Well, I don't know about big or small problem, but you really should have the urinalysis done. Have you spoken to your primary care physician about that?
No, I plan to call her tomorrow.
Good. And let me.
get that taken.
I'm sorry. Let me ask you one other question. Are you taking any different medication right now? Did she switch up
Yes.
your? Okay.
Well,
it might be nothing.
I'm on major.
Okay.
I'm sorry. There's a delay in the transmission. I
Yes,
don't mean to talk over you.
It's okay. Go ahead, Christine.
Vitamins. I have many vitamins that I'm taking,
Okay.
but I also have connective tissue disorder.
Okay.
So,
Okay.
I just don't know. And
Well-
my other question is, do you do chelation therapy?
Oh my goodness, chelation therapy is a mainstay in our facility. Absolutely, we cut our teeth on chelation. Chelation plus vitamin C therapies we've been doing for over 25 years, and I will tell you, depending on why the patient is in to see us, we do several additional bags along with the chelation, meaning we deliver other nutraceuticals for organ-specific health. For example, we use D-ribose with our chelation, as in addition to it's a cardiac sugar, so we may use that. Again, we may use some things like some other amino acids for vascular hypertension, not just the chelating agent, meaning the EDTA. So the short answer is yes. And again, even the chelation therapy, although there is a traditional recipe for the use of the EDTA carefully, we use some additions that really tend to help the outcomes for particular patients for particular challenges when we use the EDTA. I hope that helps you. And I really want you to call your doc, though, and have that urinalysis check. It could be just a simple thing from the vitamins, but it also could be something from the medication you're taking, and or it could be something else more significant, including something in terms of the liver or something. So please.
Liver related, right.
Yeah,
right.
Please have it checked, will you? Thank you.
All right, Christine.
God bless
Thank you for the call, and good luck with that.
That's a good question for when do we look at conventional medicine, right? And looking at conventional laboratory testing, conventional history and physical for a particular patient. That's very difficult. And again, I can't treat nor diagnose. But overall, I'd be looking at that. And if somebody came in with the pain where she's saying, I'd be on the horn with one of the healthcare providers right away.
And obviously, get to the
root of the cause.
Root
Absolutely.
of the
So
okay.
it's a good question.
855-839-1210 is the number here. Again, 855-839-1210 if you have a question for Dr. Molly. When we were beginning the show this morning, the news came on. And once again, we're hearing, well, COVID deaths.
COVID, yes.
Right?
Yeah.
And you and I looked at each other like, oh, here we go again.
But the statistics say COVID patients and COVID infections have gone down. So I'm not quite sure how they got the statistics. When did they compile them? And again, this is the problem with data. You got to know what's what. But we're going to talk a little bit later about the repurposing of medications. And you and I both know that during COVID, there was plenty of repurposing of medications. And oh my goodness, did my doctors take the heat because, you can't use an antiparasitic. You can't use that particular pharmacology that was an antibiotic. But you can and always have. Physicians have the ability to use off-label dosing and off-label medication. It was signed into an absolute effect in 2018 when they actually had something, an actual bill was passed saying that patients who were in very severe medical problems could look at using off-label, and maybe the insurance company should pay for it. Well, I don't know if that happened, but nonetheless, it can be done, John.
And you were talking earlier, and you're talking about subclinical doses and
sure.
repurposing of medicines.
Yeah, medication.
So talk about that.
Sure.
And how that relates to what you do at Innovative Medical.
Well, I will tell you that, of course, we have a large cancer supportive group. And again, our integrative cancer support, I know and have been using repurposed medications in subclinical dosing in many of my protocols. I mentioned one last week called LDN, low dose naltrexone. That's exactly a repurposed medication that was put out for opioid withdrawal, and we use it in a specific dosing, low dosing for autoimmune, also for cancer patients. But the list goes on. John, there is a database, and I brought it in to show you. This is a complete database put out by the World Health Organization, repurposed old drugs for new and effective cancer treatments. Okay? Guess where they're being used? All over Europe. All over Europe. So the data is there. You can find it in the Lancet. You can find some of these articles in PubMed. But there's 10 pages of repurposed old drugs. Now, the question comes in, which drugs do you use along with the nutraceutical that we use to improve quality of life? Well, there are many. We've used things that were used for diabetes, for example. And again, my physicians order that. I don't order it,
right,
but I sure as heck give them the data that I know works, and then I know the biochemical reason why it works. And most times my physicians, being the kind of folks that they are, will definitely go along with that.
We should mention that you are a scientist by
trade. Yeah,
and you have 2 PH.Ds, so we should also.
And I have 2 physicians.
And you have two physicians. Right. You got 2 of everything.
I got 2 of everything. The Lord said 2 by 2. Well, I believe in it. Okay.
So you know the science of this, and
I know the pharmacology of it.
Why it can potentially work.
Right, and I also have 2 wonderful compounding pharmacists that I can consult with and do. So here's the thing. It's very interesting. So we have incorporated that in our cancer supportive therapies. Now, some of these I actually have delivered IV, and some of them I've told people to get the prescriptions for. And again, our medical directors have written the prescriptions for this. So there are many drugs and categories of drugs. It is an amazing thing. But you know what really gets to me is this is being used in Germany. It's being used in Italy. It's being used in Australia. It's being used in London. It first came out in London. So here we are in America, the best country in the world, and we make a big deal about off-clinical use of medication. Ridiculous, right? Ridiculous.
Is that ever going to change?
I don't know. I don't know, because you and I both know big pharma is working the system. And here's the thing. We've used this category of drugs. For example, there's a cholesterol drug. If you use it in a low dose, it has had an effect on, believe it or not, certain breast cancers. Now, I'm not saying that alone, and I'm not telling people to stop their oncology treatments, but I'm saying, isn't it interesting that you can use these collaterally with natural substances? And again, if you use it in subclinical dosing and you use it correctly, no harm, no foul, and it may help.
And with that, we are at the halfway point of today's show, halfway point of today's version of Health Watch. And again, if you have a question for Dr. Molly, this is a good time for you to jump in. We have plenty of time left, and we do have some open lines, so you can get in here with a question or a medical challenge you want to run by her. 855-839-1210 is the number, 855-839-1210. The show is Health Watch, and it's here Sundays, 8 till 9 on Talk Radio 1210, WPHT. With Dr. Molly Fantasia, I'm John DeMasi. We both return after these words. And we're back here on Health Watch. Operators are standing by at Innovative Medical Associates. You can get more information if you like. But the most important thing is you want to sit down with Dr. Molly, go over your issues and situations. Well, then that's what you do. You schedule that initial consultation. It is complimentary. You can call 856-489-0505. 856-489-0505 is the number. And again, it's Innovative Medical Associates, Marlton, New Jersey. You can call them now. You can call after 9 o'clock. They'll be there all day. You can call tomorrow, 856-489-0505. That's the number. And also the website has plenty of good information on it, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. And we mentioned earlier, you know, Valentine's Day is around the corner, and you want something special for your Valentine. Well, it could be a man or a woman, whatever it happens to be. Dr. Molly has a complete line of skincare products, and just go on the website and you'll see it, and you can order it, and you got your Valentine gift. How's that? 856-489-0505 is the number for Innovative Medical Associates during the week. Right now, our show is Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHC. The number here in the studio right now, 855-839-1210. Dr. Molly, we were talking about drugs that are repurposed.
That's right.
And I've often asked you, can you show people data? Well, every week when we do the show, you bring in pages and pages of data.
I do. I do.
And it's about specific things. So I guess you could give them a volume of data, right?
I can. And the thing about these repurposed drugs, I want to say that they're old drugs. They're usually off patent, so they're very inexpensive. And they've been used for many, many years in other kinds of conditions like diabetes. Some of them are used for hypertension. Some of them are used for pain, actually, cold remedies. And if you look at the data that's coming out of England, of course, there's a divide between the conventionalists and the integrative oncologist. And you know, I have an integrative oncologist who's also a consultant to me. But when you look at this, you see that it's effective treatment for at least to help disrupt growth and division, restrict the metastases, and increase survival time and quality of life. So the bottom line is, for me, it fit right in with the hydration therapies because the quality of life issues were the most paramount for this. If you can hold down some growth, not cure the growth, not cure cancer, but again, help someone have more quality of life for 3 months or so, guess what? That's a win. That's a win. So again, I'm going to say we're not against pharmacology. We like to use it properly in an integrative setting.
So when you say repurposed drugs,
Yeah.
you're talking about, let's say, a drug may be used for diabetes, but you might be using it, your docs might be using it for something else.
To what? To lower blood sugar, because we have a philosophy that what? Cancer loves sugar. So why don't we start cutting off the growth issue? That's all. It's not curing cancer. There's certain cancers that work, and we know this. We know that there are certain old-time drugs that worked on inflation. Not inflation, that I'm thinking about our economics.
Yeah,
inflammation.
Right.
But they're out there. And so why not look at those, look at the database that's out there, see what other, physicians are using this, and then incorporate it in with the hydration therapies. And I'm very lucky to have physicians who actually aid me in doing that, and in addition then help patient outcome.
Is this something, and the name of your practice is Innovative Medical, is this an innovative thing?
I think it's innovative to always look at the old and repurpose it for what's current right now. Cancer's been around a long time. Treating cancer is a multi-billion business. So you can be sure that if there are things out there that can improve the quality of life for a patient, including natural substances, why not do this? Here's the thing, John. Whenever I look at any protocol, I'm always looking at the constituent of the product we're using. And what does that do? For example, if we use something like, we use medicinal mushrooms, right? We know that some mushrooms work on interleukin-6. Interleukin-6 is very important in inflammation. So we use something that holds down the interleukin-6. So it's an anti-interleukin. We look at prostate cancer. So I'm seeing more and more men. And actually one of my patients from Florida, her husband turned out to have what he thought was a slower growing prostate cancer. In addition, something went wrong. I don't know what happened on the biopsy, but it turned out to be a more aggressive type of cancer. And one of the things I'm looking at for them is extract indole 3-carbinol, because we use it also for breast cancer, because it's an estrogen blocker. So selenium, very important. Selenium's been around for years. Selenium, we can deliver selenium IV. And again, that's a mineral. So there are so many different types of both conventional medications that can be used in appropriate dosing, as well as natural constituents in natural substances that affect certain pathways. And that's really what we do at our
I was just going to say, that's what you do, and that's what sets you
right.
apart from others.
Exactly. We're looking at the pathways of certain cancers. I'm a big believer in these liquid biopsies, and you get back some of the liquid biopsies and it tells you exactly where the dysregulation is. Well, there's a pathway for that. In other words, someone has a problem, like I said, in a particular interleukin or cytokine. We want to look at putting that under control. So there are so many things. Quercetin, which is an extract from like onion skin. Quercetin is such a high anti-inflammatory. It's been around for years. And I'll tell you what, it works wonders for certain cancers. I'm not saying it cures, but it sure as heck improves their quality of life. And that's all we can do, is improve quality of life. And if you get a few more months of good quality, well, that's a win,
I was just going to say, I've been I'm in your clinic twice a week, and I see a lot of the cancer support patients. And, you talk to them, and
of course.
And many of them say what you just said, that they really feel much better than they did before because of chemo or whatever the case happens to be. And so you've had success with improving their quality of life and giving them
some more time.
Right,
we hope.
exactly.
I mean, that's the objective. Like
right.
Mary.
Mary, I was just
was
thinking
a
of her.
great,
Yeah, right.
great case. And I'm writing that case up for a couple of the integrative journals because that's a great case. That's a win for us. Certainly, the patient is no longer with us. She's passed on to her reward. But I will tell you, up until that time, her quality of life was wonderful, and that's what we want. And I think that for us. It resonates with all of my staff. It sings to their heart to see patients doing well. That's all we can ask for.
What did they give her? 3 months or something? And
They give her, less than 3 months.
Less than 3,
but,
and then she lasted 4 years, right?
Yeah, more than 4, and very good years. I might add. She would drive all the way up to New York to see my oncologist. I mean, she was a trooper. The other thing is, I think when people have been given a cancer diagnosis, they're blindsided. The one thing is, I always say, don't stay in inertia. You got to really continue to search, look for what resonates with you, and I'm not telling you not to do conventional treatment. I'm saying you want to get through that conventional treatment in good shape. And I want you to go somewhere that understands that if you're going to use off-label pharmaceuticals, you want to make sure that doesn't interfere with their chemo either.
Exactly.
That's very important. So, again, you can't just throw a protocol and hope it sticks to the wall. It doesn't work like that, John.
Right. But your protocols are designed, and you've got over 600 of them.
We've spent a lot of time working them out to make sure that they can work cohesively with whichever way my patients want to go. Look, I have a wonderful patient. Everybody knows her, Pam. Right? She did nothing else conventional but the surgery. And I applaud her for that. But she's not typical in my clinic. In my clinic, it's more typical that people do the surgery plus some other type of treatment for their challenge. But there are new treatments coming out every day, John. New treatments. And the point is, I would like you to live long enough to try them.
Right.
And that's the bottom line.
That's the point here.
Yeah.
We are coming up on our final break of the show, which means you still have time to get in here with a question for Dr. Molly or a medical challenge at 855-839-1210. 855-839-1210. Our show is Health Watch. You'll find us here Sundays, 8 till 9. Talk Radio 1210, WPH.D. with Dr. Molly Fantasia. I'm John DeMasi. We return. More Health Watch after these words. Welcome back to Health Watch. Operators standing by right now at Innovative Medical Associates, and we should mention that they will be there well after we leave you at 9 o'clock. Just because we go home doesn't mean they do. 856-489-0505 is the number. 856-489-0505. Innovative Medical Associates, Marlton, New Jersey. And the website, innovativemedicalassociates.com, innovativemedicalassociates.com. Don't forget about that Valentine's special, Dr. Molly's skincare products. Perfect Valentine gift. Check it out on the web, innovativemedicalassociates.com. Also want to remind you, if you missed any of this morning's show, well, we have our Health Watch replay every Sunday, 4 until 5, right here on Talk Radio 1210 WPH.D. 855-839-1210 is our number here in the studio. Dr. Molly, we're going to talk about, so we don't confuse people, hydrogen therapy.
Yeah.
As opposed to hydration. This is different from
hydrogen therapy. H2O2, hydrogen peroxide, and its use. And isn't it? Hydrogen peroxide has been around for years, right?
My mother put it on me when I got a cut.
That's right.
Remember?
And it would fizzle up, and you knew it was working and all of that. But this is very interesting. I read 2 articles. I'm always reading, John. I always look at what's going on in other countries and their use. But I'm looking at hydrogen therapy, and this is made for inhalation, which means to use it like with a puffer, those kinds of things, or, that type of delivery system. Anyway, a very interesting article because the study came out from Japan. What I want to do is utilize this along with our hydration therapy. So I'm putting together a protocol. And I'm using this for people who may have the early symptoms of dementia, forgetting your keys, forgetting stuff. Anyway, they did a study in Japan, and they found out that using this puffer they were able to, of hydrogen, they were able to improve a patient's outcome in terms of their forgetfulness, their speech patterns, this kind of thing. When people have dementia, it's very hard on the family. I have one wonderful patient who comes in with his wife, and he owns the health food store. He's tried everything, and we're still trying some things using the antioxidants, vitamin C in particular. But I think, because believe it or not, vitamin C in the body turns into hydrogen peroxide, by the way. Just a little side note, if used properly. But I'm looking at adding this to her treatment protocol because it was very exciting. This was on several thousand patients, and it came out of Japan, and they actually were able to improve them about 20-25%. So that's a big win if you have something like dementia or Alzheimer's. So I'm looking at the data on that. That's something new that's coming in the next few weeks. So I'm always improving our hydration therapies and what can work with them. So it's not just off-label oral supplements and off-label pharmaceuticals. It's things like this kind of thing, inhalation therapy. So there are many things I do with with what I do with the hydration therapies that you won't find in a spa for sure.
Do you ever sleep, by the way?
I do, but not as much as maybe I should.
The wheels are always turning.
Well, no, I you know what? I love to look at data. It's just it's like it's part of me. It's part of my DNA. So I always look at the data, and when I'm particularly interested in particular kinds of conditions, because they're out there and they come through my doors, and even if someone doesn't sign up, I really look at their particular condition and what could I've done to help improve it, in addition to my mainstay hydration protocols.
Well, we mentioned earlier that you have over 600 protocols.
Yeah.
So and all of them developed by you, but
with the help of my physicians.
Exactly.
Yes.
But there's bound to be something that you can help somebody with, no matter what the condition is.
Exactly,
that's really my point.
Exactly. And right now I have a young lady who restarted with me. She stopped for several months, and she has that plaque psoriasis, and I was talking about her last week. And she just started with me, and I took a look at this, and it is infinitely worse. And then she said to me, "No, Dr. Molly, it's not worse. It's better than it was when I first came to you." I said, but it looks worse than when you left me. She said, right, but it's still better in its worst. It's better than it was. So that really resonated with me too. And part of the issue, again, is how do I help her? Because she doesn't want to live the life of restricted diet. But I urged her to continue to restrict the diet right now while I'm giving her hydration.
So in that particular case, you need the restrictive diet. Why? Because
she also has a homocysteine response, because it's all about inflammation. So she may eat certain things, and a lot of this has to do with nightshades, for her, in particular for her. And what it tells me is those particular things contribute to this state of the body going into overdrive. That's the problem. It's really trying to help her, okay, but it goes into overdrive, and therefore what happens is she has an overabundance of the inflammatory process.
We haven't talked about this for quite some time here on the show, and when we've been doing radio, you and I, for 20 years.
Yeah, it's hard to believe, isn't it?
Hard, but we were talking about way back when about preventive measures.
Oh my goodness, yes.
Can people, in other words, we talk about the conditions and the challenges and the problems. But if you just want to be healthier.
John, we talked about a lot of prevention during COVID.
Yes, we did.
Because what do I always tell everybody? Keep your own immune system going. And it's got to be Goldilocks, right? Not too much, not too little. And that's the issue. In this case, what happens to this poor girl is she goes into an overdrive because her immune system is overstimulated in a negative way.
Right.
What you want to do is exactly what you said. Keep it going, John.
Well, that you talked about COVID, and I said this to many people, and they said, well, are you afraid of getting COVID? I said, actually, no, I'm not, because of the vitamin C
And
all
other
the
things, right.
and other things.
Right,
You know, I
right.
mean, I'm careful
Of course you are.
because you
Look,
told me I got all these challenges, and I
right.
can't.
You can't be, look, we can't be cavalier. We have to go back to kindergarten and know we got to wash our hands. We know things you got to sneeze into tissue. You know you shouldn't run up to people and cough in their face. I mean, come on. But bottom line is you got to keep your own health up. And how do you do that? I know hydration does that.
And that's what we've been talking about, not only with
Exactly.
vitamin C, but other
Certain
things.
B vitamins, certain category of nutraceuticals, beta glucan that's extracted from lecithin. There are just so many things. I touched on quercetin. Where do you want me to start, John? I mean, we could have a whole new program.
You know, it's funny because we started off the show and the news came on at 8:00 and it said COVID deaths are up,
I can't-
and then here we're starting, and then we're ending with good.
Because it's unbelievable, and it's just unbelievable that people are just don't get it. What we need to do is we must take care of ourselves. You know, the government can't take care of us, right?
That's right.
That's right. We need to do things to help improve our own health. And hydration therapy, the way we do medical hydration, will definitely tune you up.
Let's talk about we're on this preventative
Yeah.
maintenance type of thing. If somebody just comes into you and says, Dr. Molly, I just want to maintain good health, can they come in like once a week for?
Sure, or once
for-
every other week. I have patients who come in once every other week. We actually put together a plan for them. We looked at what they were lacking. Look, everybody who comes in is going to get some blood work, right? That's going to help me navigate what you really need. You could have the most perfect blood panel in the world. You still don't feel exactly right. You're still tired. Why? Okay, you might need a little boost in the amino acids. Those kinds of things. We will sit down, talk with you, and get you started.
Patients come from far and wide too. I mean,
You're a good-
the
Listen.
couple that drive 4 hours.
Absolutely. Another thing, these guys who are in the gym, right?
Yeah.
And they take what? Steroids.
Yeah.
I see a whole lot of them. They look great. They're healthy, are they? No.
No, they're not. That's right. And with that, we are going to put the wraps on another edition of Health Watch. Don't forget, operators are standing by right now at Innovative Medical Associates, 856-489-0505, 856-489-0505. The website, innovativemedicalassociates.com, innovativemedicalassociates.com. Don't forget about your Valentine, that skincare line of products for Dr. Molly, developed by her and Dr. Harvey Glass, renowned dermatologist in the area. Really a great Valentine gift, so check that out as well. And don't forget, miss any of today's show, we've got our Health Watch replay this afternoon from 4 until 5 here on Talk Radio 1210 WPHT. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, Barbara, delightful Dee, Joanne, fabulous Fran, and our nurses Jess and Lana, and our medical assistant Karen Kathy. I'm your host, John DeMasi. Thank you for listening. Have a great week and a healthy one. We'll do it all over again next Sunday. Health Watch, 8 till 9, Talk Radio 1210, WPHT. Take care.
This program is a paid commercial announcement.